Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Wow, it's almost Christmas. Still got a few shows to do before Christmas, but I really want to stress on, today, if you're listening to the original, or by the way, I don't know if I said, good morning, welcome to Insurance Matchmaking. I can't remember if I said that at the beginning or not. This Saturday, if you're listening to the original broadcast of this program, then I will be in the office, probably in the office as you're listening to this. We're getting up on the Affordable Care Act Marketplace, also known as Obamacare deadline. December 15th is the deadline for picking a plan to be effective on January 1st, whether that's you're getting a new plan or you're re-enrolling in your current plan. So we're almost out of time for that January 1st. The 15th is Monday, so today is not your last day to do it, but if you've got time, call, come by, stop, call the office or something and see if we can help you out, or, book something for that Monday. If you don't do something by the 15th, then whatever plan if you're on a plan right now, that plan is going to renew. And I know everybody's been getting the notices telling them how much their plan has gone up because they've all gone up. Now, some people who had a zero premium on a bronze plan may still have a zero premium on a bronze plan. But if you had a zero premium on a silver, you're not necessarily likely to have that for next year. It's going to be a small increase. And the increase on those, when you weren't paying very much for your health insurance, the increases usually aren't very big. And when I say not very much, I'm talking amounts that were less than $100. If you were already in like the 200 range or paying your premium, your premium probably went up a bit. And I talked a little bit, I think, last week about it. Those of you that are going to be over 400% of the poverty level, and for the couples that I've been working, and I meant to double check and see where that cutoff hit for a single person. But for a couple that's been hitting right at about $84,000, if you go over that, you're not going to qualify for a subsidy. So, worst case scenario, and I think the number's a little lower, but if you knock that down to 42, and it may be a lower amount for a single person of where you're still eligible for a subsidy. So, and what happens there, and I try to stress to people, is if you think you're going to be close, either make sure that your income doesn't go above that amount, or don't go through a marketplace plan at all, or just be prepared that whatever subsidy you're getting is going to be added to your tax burden. And I say added to your tax burden, your tax bill, whether you have been getting a refund and now you're not but it doesn't increase the income that's taxed. It actually increases your tax. So say you're getting $1,400 a month tax credit, but you're very close to that top of that 400%, and you go over it, you're going to owe $1,400 times 12 to your tax bill. And like I said, it doesn't move your income up that much. That's actually how much tax you're looking at. So a lot of people have not really understood that and that was one of the things that happened was when lawsuits were out there saying that Obamacare was unconstitutional, and the Supreme Court ruled like 5-4 that it was because it was a tax. I think that's a lot of misconception of folks that the Affordable Care Act, or Obamacare is not insurance. There's a lot of people, I don't want Obamacare, I don't want that Obamacare, I don't want that Obamacare insurance. Well, the insurance is just insurance from insurance companies. Now, there are certain plans that are only available through the marketplace, and I've talked a little bit about those, and those plans have terrible networks. The doctor reimbursement rate is less than on the regular plan, so you got to be cautious. Not saying that those don't work for some people, but you really have to look at, all right, this doctor doesn't take it, but this hospital does, or if I need to go to an urgent care, I can go to this urgent care, but I'm going to have to pay cash when I go see my primary doctor a couple times a year. Well, the savings on your premium could make that worth it. So that, there are other ways to save on that marketplace plan besides just but we try our best to make sure that all your doctors are covered, all your prescriptions are covered, and if you need to go to some place like Vanderbilt, that they're also in network, because that happens too. Some of the plans are great with all the regional hospitals, but the University Center, a medical center there at Vanderbilt, might not be in network with some plans. So that's something to be careful about. And so we look at that. So anyway, the deadline. Like I said, if you come into the office today or you get with us, in the next couple days, we can get you taken care of for January 1st. Now, who knows what Congress is doing? I'm saying who knows what they're doing. They're supposedly debating it. I think a lot of people who have higher plans, higher cost plans, they've already got the notice. They know it's going to be higher, and they're just holding out, waiting to see if Congress does put something in place, whether they extend the enhanced tax credit. And I've talked about this last week. I've got a lot of people thinking, the tax credits are going away. The ACA is going away. No, the only thing that went away was the Affordable Care Act expanded tax credits that were a COVID stopgap, supposedly. I'm not going to get into debating whether it was a good idea to do it or not, but those were set to expire at the end of this month, and as of right now, they are expiring. They have not been renewed. That was one of the things, and people like to blame the One Big Beautiful Bill. That had nothing to do with it. They could have included the extension in that and didn't, but they didn't take anything away in that bill. And then that whole thing on the government shutdown, part of the debate was extending these enhanced tax credits. That didn't happen. They are still debating. But to take to hope that it happens before December 15th or hope that happens before the end of the month, and so then you won't pay as much next year, that's a big gamble. And so what we're recommending, we're not encouraging anybody to just write it out and hope they get more tax credits. What we're recommending is and most of the people that are on a bronze plan, it's not really going to affect them that much. If you're on a silver or a gold plan, last year we recommended some folks go to the gold plan because it was only like $1.50 more than the silver, and so they reduced their out-of-pocket costs. The deductible was less, the max out-of-pocket was a little less, and they had lower co-pays, and then had a lower co-insurance percentage that they paid once they met that deductible. So the gold plan made a lot of sense for folks last year. Now, I've looked at a couple people who have gold plans, and I know I'm probably going to get myself in trouble here, but Blue Cross, you've heard me mention they've added the E-network, and that's that exchange network that I was talking about with the limited doctors and hospitals. But they still offer their S-network, which they always have, but this year there are only 3 S-network plans, 1 bronze, 1 silver, 1 gold. And so basically, and a lot of the clients I get, they only want to look at Blue Cross. So I say, okay, here's the 3 options I'm recommending that you consider. And depending on where their income falls, I may be saying, let's just take the silver one out of the options. It's still more to get the gold, but you do lower the max out of pocket. You do lower the deductible. If you're paying, the deductibles aren't that big a difference. It's $2,000 for the gold, $5,000. Actually, I think it's $6,000 with no what they call cost sharing reduction. You're looking at $6,000 on the silver, and $7,500 on the bronze. So not a big difference in your deductible and your max out of pocket. In fact, from the gold has, as I said, $2,000 deductible. Max out of pocket is $8,200. And the max out of pocket on the bronze is $10,000. So you're looking at an $800 difference in your max out of pocket. Going to the doctor a couple times a year, even if they say, hey, I want you to go have an MRI, you're going to pay 100% of the cost of that MRI because you haven't met the $2,000 deductible on the gold plan, but you're going to be paying $400 to $600 more a month to have a gold plan versus the bronze. So kind of beat around the bush, but I kind of went down the rabbit hole. We have been recommending a lot of people go ahead and get that bronze plan. If you're not getting the cost sharing reduction because you're at the lower income, you're somewhere below 250% of the poverty level, and really you need to be closer to that between 100 and 150% to make the silver plan actually viable, because when you're not getting as much subsidy because you're above the 150%, you're also getting less cost sharing on the silver, and the price difference between the silver and bronze, in my opinion, then doesn't make a lot of sense to go with the silver just for some lower deductibles, because you're basically probably not going to reach the deductible. So the bronze to me makes more sense. Because I got to tell you, you can, instead of paying $250 for a silver plan, you could be paying $0 for a bronze. You still have copays, but the copays are going to be higher than the silver. But if you're saving a couple $100 a month and you're paying $20 to $40 more for a copay, you're still going to come out ahead. So what we've been recommending a lot is to look at something supplemental. I'm not going to say the name of the plan again. Got to be a little cautious when I start naming company names, that they could say, "Wait a minute, you're misrepresenting us, or you're recommending, or it could be the opposite. You keep mentioning that company. You never talk about us. We're not going to let you sell our products anymore because you never talk about us." So I try to avoid talking about the different company names. But there is one plan out there. I will tell you the name of what the name of the plan is. It's called TrioMed. I'm not going to list the carrier, but what it does, and I'm not sure why they call it Trio, because to me it's just kind of it's a two-part plan. But it has a critical illness component, and it has a accident or injury component. And what I like about that TrioMed is, for an individual, it's $52.69. If you are a couple and you're both on the plan, the monthly premium is $75.75. And the reason I bring that up is, if you're going to don't spend $200 to bring, or more, to bring your deductible down with a silver or gold plan. Spend that $52 or $75 on this supplemental plan, because if you have a heart attack or stroke, it's going to pay you $10,000. And you've now covered your maximum out of pocket for your treatment and your hospitalization. The accident part is a little different. It'll pay up to $10,000, and what it is, the $10,000 is, it's based on what you're billed for that injury you received. Say you're only billed $4,500, then it's gonna pay for the $4,500. It's not gonna pay $10,000 because you have a $4,500 accident bill. But that also leaves, you still have $5,500 of balance left if in the year you have another accident. So it doesn't take away from you. It just is. But it's going to cover up to your deductible, because that's what your bill was. So those are some things to protect yourself against the out-of-pocket cost. And the reason I bring that up, I'm saying we're coming up on the deadline to have your plan in effect for January 1st. And I'm getting close to the break for the commercial, so I kind of want to hold off on going too much in depth of what I'm saying. But if you go ahead and sign up for the bronze plan now, you might be able to. You still have the opportunity to change the plan after the 15th for it to change February 1st. But if you don't change that higher cost now, that is what you're going to have to pay for January. So it does make sense to maybe go to a lower plan for December and then reevaluate what you're doing, and then maybe change it for February and go back to the silver, possibly, or the gold, and have those lower deductibles. But we're coming up here on the commercial break, so when I get back, I'm going to go in a little more depth on what I was talking about, why you want to go to the lower plan.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
What are you dreaming of this holiday season? If it's faster internet and a lower cell phone bill, TriLight Mobile can make your holiday dreams come true. Internet plans start at just $34.99 per month, and your first cell phone line can be free. TriLight Mobile makes it easy to switch, and if you like your current device and number, you get to keep them. TriLight Mobile. It's better wireless from the company that brings you better internet. Call 844-874-2355 or visit TriLight.net to get started today. Some restrictions apply.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back to Insurance Matchmaking. I was talking there just before the break about why it really is imperative to make a decision about your marketplace health plan in the next couple days. This, as we're airing, let's see, and I went blank on the date, but Monday is the 15th. That is the deadline. So here on the 13th, if you need to get that done. You need to get that done, and here's why I say you really need to to actively re-enroll in your plan. Sometimes it's maybe you had estimated your income as a higher amount, and with that higher amount of income, you've been getting enough tax credit that you got a little bit of a refund when you filed your income taxes. But now that the rates have gone up, now you're going to have to pay a little bit more up front for your insurance. So you may want to reevaluate what your income is. Again, a lot of times I get people who are at the they're at the higher income limits, and they're also a little bit older than some of my other clients, and they're getting ready to retire. They're getting ready to start their Social Security, and depending, there could be job changes where you were making $70,000 a month, or a month. I wish I was making $70,000 a month. $70,000 a year is a couple, but one of you has ceased working and is drawing Social Security, or you're now retired and you're drawing some pension and Social Security, but that income now, instead of being $70,000, is $50,000. You definitely want to update your income for the marketplace and see where you stand to get a lower rate. Now, of course, it's not going to kill you if you end up in the paying more for January, but you really want to look at going ahead and lowering that cost for January. And again, if they pass some sort of extension for the tax credits, if you're in a lower cost plan, you can always switch to the higher plan. And my guess is if they do something like that, they're probably don't say you said it was going to do this, but I would imagine that if they do some type of last minute extension or expansion, that they're going to extend some deadlines. But don't count on it. That's the point I'm trying to make. Don't count that there's going to be a last minute reprieve when it comes to the tax credits. I'm recommending go for the bronze plan if you're on a silver or gold. Get the lower cost, and then let's reevaluate it after December 15th, before January 15th, to see if that's the plan you want to stay on. The other thing I was reading this morning, that one of the plans in the Senate, which is kind of one of the things the president's suggesting, is put money in a health savings account instead of paying it out as a subsidy that just reduces what you have to pay to the insurance company. But to be an HSA, they basically have to be a bronze plan. So it would make sense to, and one of the plans that I've recommended here in the first half there, that bronze plan is HSA eligible, and there's other plans with the other carriers also. When I bring that up is because you can have a plan that has HSA, and it does have co-pays. So you're really pretty much only going to need the HSA to cover those things that are subject to the deductible that are going to be big ticket items. And then again, like I say, an MRI, an outpatient surgery, those things that you're going to have to pay 100% until do that. So that's what they're talking about doing. Now, I don't know exactly how that money's going to work. I think it's going to work. It'll work something like the COVID stipends we received, that those did not increase anyone's income. They weren't like, oh, that's Social Security, and they weren't counted for tax calculations for the marketplace. So if you got a $500 check from the government or a $1,000 check from the government during COVID, that didn't raise your income. Now, I think it could have possibly affected people who are on Medicaid, but those are not the people we're talking to today. Anyway, we're talking to people who are using the healthcare marketplace, so if they put money in your HSA account, you can use those funds for your health care, for your health needs, and I'm pretty sure you can use it for dental costs. You may even be able to use it to contribute towards your premium. I'm not sure on the rules on it. I've never had an HSA, so I don't know all the rules on it, but I do know I kind of like the idea of, instead of just giving everybody a subsidy that, and as they say, just goes to the insurance companies, and that they can charge more premium because you have the HSA. And that's kind of, I think, the goal here is the bronze plans are considerably lower premium. the plans are virtually the same. It's just you're paying more for more of the healthcare portion. So if you have the HSA to help pay for your medical costs, those are costs that, because they're not being paid by your insurance company, that you still have to pay them. So you're paying them to the doctor, the hospital, the ambulance, the providers. So that's something there. I mean, that's not a bad idea. I still don't know how they're going to implement something like that quickly, but they do have some time on that too, to say, hey, if you signed up for a bronze plan, you're going to qualify for this HSA. Go online, fill this out, send this form in, and we'll send you the check to do it on it and put it in account. I probably need to get one of my banker friends on here again in the near future. Maybe even next week. Is one of the reasons there is you can go to most banks. I mean, not every bank will do it, but I know some of our local banks. And if you work in the banking industry and you're listening to this and you'd like to share your knowledge about health savings accounts, reach out to me. We'll get you on the show, because I don't want to sit here and tell people how to do something, and that's not my specialty. I'm not a banker. I feel like sometimes I'm giving tax advice. I'm not a tax preparer, but I do know some of the ramifications of how your income tax and how your subsidies affect your tax returns. So I do, address it, but I also say, I think it'll work this way, but double check with your tax preparer. I had somebody mention to me the other day, I've been saying all along that if you are receiving alimony, that's considered income, or it's tax deductible because you're paying it out. And some of those rules have changed. And so, like I said, I'm not a tax preparer. I don't know all those changes. Talk to your tax preparer. Money in the bank because you sold your home. Now, that's not necessarily going to affect your income for the marketplace, because you do have time to reinvest that into a new home. And so the IRS looks at it a little differently of, hey, you don't have to do anything on that until, for 2 years if you don't reinvest or something. I don't know. Again, I'm not a tax preparer. I don't know all those rules. When I've, bought a house, sold a house, everything just kind of rolled over anyway. So that worked for me. But I had somebody talk about, well, they sold a house, but have children on the children's health insurance program, which is managed by TennCare. Now, TennCare, just doing your health care Affordable Care Act application isn't necessarily going to remove those children from the children's health program unless your income went up and you go over a threshold that they're no longer eligible. But unless you get something from TennCare, or Medicaid if you're in another state, is saying you need to recertify your children's insurance status, your income status. Now, they're going to look at what you have in the bank. So if you have the money sitting in a bank account or sitting in any other kind of account, because they're going to want to know, if you put the money in an annuity to earn some interest until you got ready to buy your new house or build a house, they could look, could say, well, you have that asset, you could spend that on your health insurance, so your kids have to be on your health insurance. So that's something that, the Medicaid system could do, but just having money in the bank does not affect what you get as a tax credit for the Affordable Care Act. So I talked to a lot of my older clients that maybe they have retired, they have a pension, they have qualified funds in a 401k or a IRA. I don't know what I was going to say there. If you take money out of those accounts, as that money is now taxable. So that's taxable income. And if you're drawing Social Security, even though it's not taxable income, it does count towards your modified adjusted gross income for computing the tax credit. So I warn people, let your retirement funds build a little bit. Wait until neither you or your spouse are on an Affordable Care Act and getting tax subsidy before you up those withdrawals, and just kind of live on a tighter budget. Pretend you're newlyweds again, and you only have so much money. And I always caution you, it is the tax year. So say you're already on Medicare, you're drawing out some from retirement funds and Social Security, but your spouse is still on an ACA plan, but they're going to turn 65 in June and go on Medicare. That is not the time to start drawing more out of your IRA. You still need to wait until January of the following year because you're going to file your taxes on that year. So any increase to your income is going to affect what you're drawing out. Now, of course, as I said, if you earn more than you estimated when you did your application, then you're going to qualify for less tax credits when you file your income tax. So you're going to have to pay back the excess. Now, if it's a couple $1,000s, it's not going to be a lot on the difference in the tax credit. But say you're drawing another $20,000 or more out of your income, then it's going to raise your tax credit. And also you got to be cautious of if you were close to the top of that 400%, it could push you over. So make sure you stay under that cap at least, so you don't have to pay all of your tax credit back. But if your income's higher than what you estimated, it's gonna affect that tax credit. So let's be cautious on that. And then I don't hate beating the dead horse here, but if you're on a silver plan, and I talked to Bree yesterday and got people just saying, I'm just not going to get it. It's too much money. And I get it, especially if you're paying a couple $100 a month for your silver and now it's over $400. That's a lot of money. But don't go without insurance. If you switch to the bronze, yes, you're going to have a higher deductible, but you have health insurance. You've got something that's going to cover. You're not going to lose your house because you ended up in the hospital for 3 weeks after a heart attack or a bad car wreck. So have some insurance in place. The other thing is we have plans out there we call fixed indemnity plans. I've talked about those before that will pay so much. They'll pay so much for a doctor visit. They'll pay so much for an x-ray. They'll pay so much for an ambulance, so much for a surgery. Those are great, and they're a lot less than what somebody might be paying for their health insurance. We also have the MediShare. We have the short-term plans if you have no pre-existing condition. And that's the other thing. Those indemnity plans I mentioned, the fixed benefits, they are going to be underwritten too, like the short-term health. So if you have pre-existing conditions, you need to have something in place. And like I said, worst-case scenario, at least get that trio med. You know you're going to have $10,000 if you do have a major accident or you have a heart attack or stroke or something like that, because you're going to have a big hospital bill, and that's not going to pay all of it. You have a heart attack, go in the hospital because you're going to be in there for a few days. That $10,000 is not even going to cover all of it, but that $10,000 comes in very handy with the $10,000 max out of pocket on your plan. The other thing is, now I say the $10,000, the trio, but it has several levels. It goes all the way up to $30,000 of critical illness, and I have other plans that will pay out so much, for critical illness. If you have a heart attack or stroke, I've got one plan. It goes all the way up to $75,000, so it could pay out $75,000 for if you got cancer, or $75,000 if you have a heart attack or stroke. Now, of course, that's going to be more than that $52 I was talking about, but it still may be less than what you're paying for your health insurance. So, protect yourself. We have a lot of ways to protect you, and it's not just through the ACA. So, the whole thing I've talked about before, it's been a while, but insurance is transference of risk. Everybody's gotten with the situation of insurance is health care. Well, health care is what you get at the doctor, and your health insurance plans generally help pay for that health care, but it's there to cover the stuff you can't afford if that's unexpected. I've used the analogy. I've had my car insurance for years, and they haven't paid for a single one of my oil changes. They don't pay for my tires. I still have to pay for the maintenance on my vehicle. But if I have a wreck, or God forbid I kill somebody in a car crash, I have insurance that's going to cover me instead of them suing me and taking everything I have. Well, you got to kind of think about that with your health, especially if you got kids, and you may have the kids covered somewhere else, but something happens to you, you can't take good care of your kids. So you need to have something that keep you from losing everything or having a bill that puts you in bankruptcy. And there are supplemental plans out there that are very affordable that can protect you against that. So looks like I'm out of time, and until next week, stay tuned to Grace 107.7, and next Saturday we'll be back with Insurance Matchmaking. Remember, at Matt Libby Insurance, we can cover you head to toe. It doesn't have to cost you an arm and a leg.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.